in most of the counties in our state that have innovative ideas how to deliver prevention messages, how to get more treatment available to the people in need. This money will give us the ability to grant that out to those with the innovative ideas to make a difference. That's where this is going to help us.
So it really is allowing local governments, state governments to be those crucibles of experimentation and find out what is going to be the best practice to try and address just an incredibly difficult problem. There are no easy solutions, and it's got to be an all-above type of strategy, addressing the supply, addressing demand, and addressing treatment. And so I would much rather look to the states, people like Attorney General Schimel, to try and figure out the best way to address this, and then we'll learn from each other. And we talked about what's happening in Colorado right now. Let's take a look at the experience of legalizing marijuana and see what kind of harms are potentially created by that. So let's let the experimentation begin, and so those grants are starting to be granted or starting to be issued.
You commented that single mothers should get jobs in their children's child care. Do you still stand by that comment? That was something that I was going to ask you.
I'm not exactly sure you're exactly quoting the problem. What I'm talking about is when it comes to our poverty programs, we have to take a look at the results. Have they worked or have they not worked? And it's unfortunate, having spent $13 to $22 trillion, depending how you cost it all out on the war on poverty, the real results have not proven that we've alleviated poverty. Nothing could be further from the truth. Poverty rates are pretty well flatlined at 15%. The number of people in poverty from the 60s to now, 29 million to 46, 47 million. So we need to rethink all these things. That's what we're doing here, lay out the realities. And so all I was talking about is let's be innovative in our thinking. Let's actually help people, certainly through our Joseph Project. And Cory Gardner, I met with Pastor Jerome Smith, taking a look at that example, how we can actually alleviate that type of poverty. That's what's going to work. So that's all I'm talking about. Is how can we get people trapped in that cycle of poverty, despair, and penance? How can we connect them with opportunities so they can have the dignity of earning their own success and pull themselves out of poverty with our help?
Does Trump's wall help fight the heroin epidemic?
If we can secure a border, absolutely would. Absolutely would help fight the heroin epidemic. We had testimony before our committee. General Kelly, head of Southern Command, said that we actually can trace. We have visibility over 90% of the drug traffic flow. We're just not interdicting it. One of the reasons we're not interdicting it is because we have completely porous borders. We're only stopping 5 to 10% of illegal drugs coming in through our southwest border. So we've got to secure that border. And again, for multiple reasons, it's the immigration system. And Cory and I both agree we want to fix this system. We need to secure a border. Public health and safety. There are drug-resistant strains of tuberculosis coming in this country, other diseases endemic in less developed countries. It's a public health and safety, the drug demand here, but also how about national security? If I'm concerned about ISIS operatives coming into America, I'm far more concerned about them coming through a porous border than I'm through other methods.
How do you secure the border? How do you secure the border?
We need to be committed to it. We have to put the resources to it. Listen, you are going to need better fencing in certain areas. I don't think we need a 1,700-mile wall, but we can utilize technology. We're probably going to need more boots on the ground. What it's going to require is a commitment on the part of the chief executive. We haven't had that on a bipartisan fashion in decades.
All right, that's it, guys. Thanks.
Okay, thank you.